Jasmine, and in today's video we are going to be discussing spina bifida, what it is, how it's treated, and how we can support those living with the disease. So I hope you enjoy this video, and let's get started. So what is spina bifida? Spina bifida is a congenital condition that affects the spinal cord and spine during fetal development. Spina bifida occurs when the neural tube, being the structure that forms the brain and spinal cord, fails to close completely during the first few weeks of pregnancy. As a result, part of the spinal cord and the surrounding spinal column remains exposed or unprotected. Common signs and symptoms of spina bifida include physical manifestations such as having an open spine, muscle weakness, and orthopedic malformations such as club feet and knee and hip problems, and then also neurological symptoms, so paralysis from the affected area of your spine and down, which then in turn can cause bladder and bowel issues such as incontinence, which is when you don't feel the need to go to the washroom, so you don't know when you have gone to the washroom, and you are often wetting and soiling your brief or pants. So it's important to know how spina bifida can be diagnosed. So since this is a condition that occurs during fetal development, prenatal testing is very, very important, and proteins can be tested and screened for that can identify this condition. The specific protein that doctors and labs will look for is the maternal serum alpha fetoprotein, abbreviated to MSAFP, and that's a screening that will be done. Doctors often also would like to do an amniocentesis test, which is when the amniotic fluid, being the fluid that protects the baby when the fetus, when it's in the womb, is tested for certain proteins that can identify the likelihood of a condition such as spina bifida happening. Other ways that spina bifida is diagnosed and detected is through postnatal evaluation and imaging, such as ultrasounds. So it's very important that a pregnant woman goes in for regular checkups to make sure that their fetus is developing in a healthy manner, so that they can prevent any conditions or any adverse effects of conditions from happening. So how is spina bifida treated and managed? So surgical correction is an option for some patients with spina bifida, so to correct their spine and prevent any adverse side effects. Physiotherapy and occupational therapy are very important because they help to support mobility needs and to teach daily living skills to be able to function with the condition and to complete activities of daily living. Assistive devices such as braces and wheelchairs are extremely helpful for those living with the condition, and it helps them, again, complete activities of daily living and have independence and the ability to move around. And finally, medications are available to manage symptoms, so it's symptoms that may be related to the bowel and bladder problems that the condition can cause, for example. One thing about spina bifida is that it requires lifelong care and management, so it is crucial that those living with the condition attend regular medical follow-ups to address complications and to maintain their overall quality of health. So being sure to book in with either practitioner is extremely crucial to make sure that they are functioning at the best possible way that they can and are not running into any further health issues. So how can we ourselves support those living with spina bifida? We can encourage self-care and independence because this is such a serious condition. It can really have an effect on an individual's dignity, so encouraging their ability to perform self-care tasks can allow them to feel more independent and can enhance their dignity. We can also help by creating accessible environments. So creating environments that are accessible by the assistive devices that these individuals might be using, such as wheelchairs or braces, crutches, etc. And just making sure spaces are safe and comfortable for these individuals. On that note, creating safe spaces also means creating spaces that allow the individual to discuss emotional and psychological challenges, can help with their ability to cope with the condition. On that note as well, promoting self-advocacy and encouraging them to participate in their medical care and decision-making ties in with increasing their dignity and their independence and self-confidence, which is crucial to an individual's quality of life. We can also help by advocating for workplace and school accommodations, making sure that these are environments where they can function to their best capability and participate in society. And finally, educating on spina bifida resources and support groups is a great way to support those living with the condition, because it can allow them to meet with individuals in similar scenarios and allow them unique support to their condition. A great resource for those living with spina bifida is the Spina Bifida and Hydrocephalus Association of Canada, which you can check out at www.sbhac.ca. And this can provide a bunch of information on different resources available to support those with spina bifida. Thank you very much for watching. I hope you learned something today and enjoyed this video.